Hey, everybody. Welcome to Dr. Cece Says, the Mental Health Awareness Edition. So, first, let me say thank you to everybody that's been rocking with me the month of April with Dr. Cece Says. Thank you to everyone that's on tonight and everyone that will view this or do the replay. So, before we get started, I wanted to just kind of go back a little bit, give you guys a little bit of background about me so you understand kind of my journey with mental health. And then tonight I wanted to talk about two very prevalent mental health diagnoses in our country. Right. And so for those that don't know, the month of May is Mental Health Awareness Month. And so every Wednesday this month, I am going to be talking all things mental health. So we're going to talk about diagnoses. We're going to talk about just some general strategies that people can use. We're also going to talk about how to find professional mental health help, okay, when needed. So anybody that knows me knows that I like for you guys to talk back to me, drop things in the chat. If you have any questions or any comments, please drop them. I'm getting better at this live thing, so I'm able to kind of see the comments while I'm doing the live. So, if you drop a question, I will try my best to answer it. If you have a question that you do not feel comfortable dropping in the chat, please feel free to DM me. Right? It's totally fine. I will try my best to answer whatever you send me. Okay. All right. So let's get started here. My question for you guys tonight: what do you think are the two most prevalent mental health diagnoses in our country? All right. What are two diagnoses that mental health providers are seeing all the time? All right. So feel free, drop some guesses in the chat. And while you do that, I wanted to give you a little bit of my background. So most people know that I started at the illustrious Tuskegee University, Mother Tuskegee, where I got my bachelor's in psychology. And after leaving Tuskegee, I went on to the University of South Alabama. Shout out to the Jaguars. And so at South Alabama, I actually got a master's in applied psychology. And so South Alabama is really where I got my love for clinical work. And so when I say clinical work, I'm talking about therapy as well as psychological evaluations or testing. And for people that don't know what testing is, like if you or a child that you know is having some difficulty with inattention or with hyperactivity, they might go for testing to see if they have ADHD. All right. We also do testing for learning disorders, and depending on your age, like if you're an adult, sometimes there's even testing to see what's going on personality wise. Right. So South Alabama is really my foundation. That's where I learned the art of therapy, and I also learned how to do psychological testing. So I stayed there for 2 years, left there and went to Tennessee, University of Tennessee, Knoxville, go Vols, for my PhD. And so I stayed at Tennessee for 4 years. Now, during my time at South Alabama, right, so that was my foundation, I did a lot of therapy, a lot of testing with children, with adults in the community, and also with students at the University of South Alabama, because we had a psychology clinic on the campus. Same at the University of Tennessee, right? So I did a lot of therapy with people that went to University of Tennessee, but also people from the community. And so again, children, young adults, teens, as well as older adults. And so, of course, that being my doctorate program, I also taught psychology classes. I also did a lot of research. And of course, I did this really big research project called a dissertation. All right. So you would think 2 years in a master's program, 4 years in a PhD program, I'm finished, right? Not at all. That is not how this journey to becoming a psychologist goes, right? So once you finish your work in your program, you then have to do what we call a pre-doctoral internship. So this is pretty much like some more training, but it's outside of your program. So somebody else can vet you and say, yes, you are prepared to be released into the world and, be a psychologist at some point, right? So my 1 year pre-doctoral internship was at the University of Florida in Gainesville. Go Gators. And so if you notice, I've kind of hidden all of the SEC everywhere except for Alabama, where I'm from. So in Florida, for that year, I worked at the Shands Hospital, which is on the campus of University of Florida. And so I did a lot of work with people that were inpatient as well as people from the community. And so I also did a lot of work with people that had medical concerns and they were having emotional difficulty because of the medical concerns. So, people that were waiting for heart transplants, people that had sickle cell, people that were moving more towards end of life and they needed some support around that. Did a lot of that work, a lot of work with people with sleep concerns. And so I worked in a sleep disorders clinic. Also did a lot of work with intense anxiety. Right, and I worked in an intensive anxieties clinic. And of course, the testing. So, still doing testing for things like ADHD, people that had traumatic brain injuries just to see how they were functioning cognitively. So, a lot of experience, a lot of clinical work. So, finished the 1 year pre-doctoral internship, and now I can graduate. Now I'm a doctor, right? And so there is still a process to becoming licensed. And so with licensure, it can take a little bit. You definitely want a job because you've been in school now like 4 or 5 years, right? And so a lot of people will opt to do what we call a postdoc or a postdoctoral fellowship. So the postdoc can be a year or it can be 2 years. And what you're doing is, even though you're a doctor, because you're not licensed, you can't work on your own. You need to work up under someone. So a postdoc provides you supervision from a licensed psychologist, usually more than one, as well as, more pay than you were getting when you were in school and more training and more experience, right? So I opted to do a 2 year postdoc at Johns Hopkins School of Medicine and Kennedy Krieger Institute, which for the people that don't know, that's a children's hospital up here in Baltimore. And so experience was amazing. And that is a lot of the reason, part of the reason why I am still in the Baltimore area today. Okay. And so along that journey of, doing my 2 year postdoc, I became licensed as a psychologist. Just a side note, there are some states where you can't even call yourself a psychologist until you become licensed. You can call yourself a doctor, but not a psychologist, right? So there are a lot of different rules and regulations, and that is for a good reason, right? And we'll get into that a little bit more as we talk about how to find good mental health care. But anyway, so finished up all of that. And the reason I'm telling you guys this, one, because I want you to understand some of the experiences that I've had when we start to talk about these mental health diagnoses. But two, because there's a process here, right? And so sometimes when people bring their children to my clinic where I work currently, they'll say like, oh, we want a doctor. And so pretty much everybody that works with me is a doctor. And so we assign them to someone. It might be a postdoc. And so right now I am directing that same postdoctoral fellowship program that I told you guys I did a few years back. So the 2 year postdoc program that I was in for my clinic, I'm now directing that program. So I get to work with awesome doctors who are not licensed yet, who are still like working under my license and working under the license of some of my colleagues. And they're getting really good training, but they have been working and training for years. Right. And so sometimes when they introduce themselves and they say, hey, I am Dr. Smith and I am a postdoctoral fellow and I am working under Dr. Culpepper, people get a little nervous and they say, well, we want the supervisor. right? We don't want the person being supervised. We want the supervisor. But when you get a supervisee, when you get a postdoc, you are getting someone who also has another set of eyes, right, on what they're doing and has another set of eyes on your case. And so, like, for my people on here that's from Birmingham, like University of Alabama at Birmingham, UAB. UAB is one of the leading like research and training hospitals. You might have a lot of doctors on your case, which is actually a good thing because you have a lot of eyes on your case. And that's because they're doing training and they're also doing research, right? So just a little caveat, if you go to therapy and you're at a training facility, especially a top-notch training facility, just know if you are working with a trainee, you also have at least 2 licensed providers that are also working on your case. Okay. All right, let me look here. What do we say? Hey, everybody. Okay. Brian said anxiety. Eddie said anxiety, definitely. All right. Coco said depression or anxiety. And actually, all of you are correct. So the 2 most prevalent mental health diagnoses right now would be depression and anxiety. So those are the 2 that we're going to talk about tonight. Okay. All right. Dr. Walker said the standing question is, what do you think is the most? Okay. He was just restating it for everybody. Thank you. All right. So let's start with anxiety. Okay. Oh, hey, Amaris. Yes, go Gators. So let's start with anxiety. So I want to read you guys just a couple of the statistics so you know just how prevalent this is. And then we're going to talk about what are the symptoms. Okay. So in any given year, because, we know with the pandemic, things have actually gotten a lot worse. And I'll tell you guys about wait list and how taxed the mental health providers are, right? But we are stretched thin because there are so many people that need help right now. Right. And so with anxiety, though, the numbers kind of stand. In any given year, almost 1 in 5 adults show symptoms of an anxiety disorder. And it's really important to note the wording. They didn't just say have anxiety. They said show signs of an anxiety disorder. And we'll talk about what the difference is. Okay. 1 in 4 adolescents or teens, so anywhere between 13 to 18, live with anxiety or symptoms of anxiety. And so something that kind of continues to hold true, most anxiety disorders can be seen kind of equally in men and women or boys and girls. But there are 2, social anxiety and obsessive compulsive disorder. Those 2 seem, excuse me, let me back up. OCD and social anxiety are seen equally in men and women. Everything else is actually seen more in women than it is in men. Sorry, I had that turned around. Okay. Now, somebody drop in the chat for me, and some of you all know this answer already because we have these conversations all the time. But somebody drop in the chat with me, what diagnosis kind of do we see all the time with anxiety? What almost always comes along with anxiety? So while you do that, I'll read a little bit. Okay. Yes, Coco. So with postdocs, you are getting more support, right? You are getting the postdoc who, again, is a doctor, right? They have been doing clinical work for years. They're just not licensed yet, right? So you are getting the postdoc and you're getting me, right? If I'm the supervisor, because they're working under my license. And my license is important to me, right? So I'm going to make sure that as much as I know my own specific patients' cases, I also know my postdocs' cases. Yep, so definitely. Hey, Tanika, Dr. Tanika. All right. Nisi said bipolar disorder. Definitely, you can see bipolar being concurrent with anxiety, but the one that I was looking for is depression. So a lot of times we see anxiety and depression kind of going hand in hand. Okay. All right. Let's talk about the symptoms of anxiety. Of course, we know what the word means, right? So we're looking or talking about fear. As a provider, I'm looking for people to talk about worry, right? Or talking about being afraid or being scared. Now, is that enough for a diagnosis? Of course not, right? And you'll see as I go through anxiety and depression, there are a lot of caveats. There are a lot of conditions placed on this. And that's important because you want to make sure that you are with a licensed mental health provider, right? Or a trained mental health provider when you are looking for these diagnoses, because there are different caveats here. So, with worry, we have what we call like productive worry. So all worry is not bad, right? So productive worry would be, a kid has a test coming up. They are a little concerned about it, so they study. That's productive worry, right? As adults, we have a big presentation coming up at work. And so we prepare, right? We do a PowerPoint. We do, our research. That's productive worry, right? There's nothing wrong with that. If you want to talk about safety, I always tell my patients, if you're in a dark alley at 2 a.m. trying to get to your car, I want you to be a little vigilant. I want you to be looking around. I want you to be sensitive to sounds, right? And so that might seem like fear, but what it is keeping you on guard because the situation that you're in might not be safe. Where we see the issue with anxiety disorders is that worry either is not what we would call rational or helpful in the situation, or there's just too much of it. So I'll tell my patients, if you see a house cat, right, a kitten, and your reaction or your emotions are more like you've seen a tiger, that's what we're looking for when we talk about anxiety, right? So you're seeing something that has no real kind of danger attached to it, but your response is that there's some danger there, right? The way that you feel like there's danger when there's not. And it doesn't always have to be like physical danger. It doesn't have to be about your physical safety. It could be about what I call social safety, right? So when kids say, "Oh, I can't go to school," and we'll talk through that, we'll unpack that. "I can't go to school. What if?" And so when you hear anybody, kids or adults, saying "what if" a lot, you start as a mental health provider, you start to kind of tune in and start to look for other signs of anxiety, right? But if a kid is like, "Well, what if I say something and people make fun of me? What if I, make my friend mad and then they won't be my friend anymore?" And they get so upset about it that they feel like it's unsafe, socially unsafe for them to then go to school. That's a part of anxiety. All right. So, okay. There are other symptoms of anxiety, right? So we're not going to diagnose you with just one symptom. So you have to have a number of things. So in addition to the worry, we also have like these feelings of irritation or agitation, and that might come out in your behavior. So a lot of times, when people come in and I diagnose them with anxiety, let's say 16-year-old male, and I'm diagnosing him with anxiety, his parents might say, "But he's not like scared. He doesn't look scared. He's not looking down, mumbling, trying to withdraw. He is like lashing out and being nasty." That can still be anxiety, right? Because what's happening is that you are so irritated and agitated, like, us like Baptist people would say, your spirit is so vexed because of all of these anxious thoughts that you're having, and because your body is in this fight or flight type of situation, that instead of retreating, sometimes you will lash out. So first thing I want you guys to remember, don't think that anxiety always looks like fear. Excuse me. So next thing we have trouble falling asleep. Somebody tell me why that might be an issue. Why would you have trouble falling asleep? Okay, Nisi says she sees this with her seventh graders. Yeah, right. And we'll talk about it with depression too. A lot of times you guys will see things and we look at the surface because we're going about our day. It's not because, we don't want to go, more underneath that. We don't want to go deeper. As teachers, because Nisi is a teacher, as teachers, you just don't really have the time all the time to do that with each individual student. But just know whatever you're seeing on the surface is kind of like an iceberg, right? You see the tip, there's probably a lot of things up under the surface. Okay. Yeah. So Tanika said stress, definitely. Mind racing. Mind racing is one of the biggest things with the sleep. Right. So for adults as well as for kids. So when someone comes in and they say, I can't sleep. I lay there, I'm looking at the clock, and I just really can't, fall asleep. If I do fall asleep, I'll stay asleep, but I can't fall asleep. A lot of times it's because they have racing thoughts. And so if your mind won't calm down, your body can't calm down, and then you are going to have difficulty going to sleep. Some people, their bodies will tire out, they'll go to sleep, but then they wake back up, right? So I have a lot of patients that'll say, oh, I went to bed at midnight, but I was back up at 2, and I was back up at 4, and I was back up at 6, right? And so you can imagine, like, think about as adults what that would do to us. You can imagine what that does to a kid. And so that's another symptom that we look for specifically in kids with anxiety, difficulties in school. Because if your mind is racing, you're having all these worry thoughts, you're agitated, you're irritated, you're having trouble sleeping, 9 times out of 10 you're gonna have trouble in school as well. All right. So also feeling exhausted even after you've slept. And I try to explain to my patients it's because, yes, you got like a certain amount of sleep, but you did not get restful sleep. You didn't get peaceful sleep. Because again, your mind was still activated. That meant that your body was still activated. So a lot of times people will wake up and they say, I feel as exhausted as I did when I went to sleep. That's why. Right. And then going out of your way to avoid situations. This is huge. And I think because as people we're used to just going, 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 we will accommodate somebody's avoidance and don't even know it. All right. And we do it for adults and for kids alike. But let's say that a child, won't talk to anyone in school, like won't talk to any adults. I have seen numerous times where kids will have friends talk for them and they don't even have to ask. The friends will basically volunteer because they notice, oh, my friend has an issue speaking to the teacher. They'll ask questions to the teacher for this friend. That's accommodating. And once you're in therapy, right, like if you are dealing with some avoidance, once you're in therapy, we'll talk about why accommodating, while it's very nice, right, it means that somebody cares about you and they want to help you, it's actually not helping us. It's allowing us to continue to have that anxiety. And what we know about anxiety is that it will grow if it's not checked. All right. Okay. Coco said, and this is why we need to utilize our insurance. Yes, ma'am, sis. That is absolutely true. And we are going to talk about that. So probably week 3 or week 4 of this month, we're going to talk about why we need to seek professional help sometimes, right? And when we do, how do we make sure that we remove the stigma from seeking help? Because in a lot of communities, especially communities of color, we have an issue with going to see somebody. All right. So we'll definitely talk about that. Okay. So a couple of other things that we notice a lot with kids with anxiety, they're not eating well, right? So think about, again, if your body is in a fight or flight type of situation, you're not trying to eat, right? You're trying to save your life. And a lot of times I have to explain it to parents that way. Your kid is literally like they feel like they need to fight for their life. So they are not worried about chores. They are not worried about doing homework. They are not eating well. They are not sleeping well, right? And sometimes they'll get a little nasty with you because again, they feel like they're not in a safe situation, whether that's physical safety or whether that is more social safety, right? Okay. So something else with kids is when they're younger, we see that they're like clinky, right? Or that's what they'll call it, clingy. It's really like part of like separation anxiety, so they don't want to see you go anywhere. And it's not just, oh, my kid loves me so much they want to be up under me. No, these kids have like significant angst and worry about what is happening when my parent or when my loved one is not with me. Right. And so usually that type of anxiety, we see that around 5, 6, maybe 7, 8 years old. As they get older, that morphs into something else, again, if it's not checked. And so it might be separation anxiety in a 6 year old. It might look like social anxiety in a 13-year old, because then, like their environments have shifted and what they're interested in and who they care about has shifted at that point. All right. Oh, hey, Gigi. All right. So, going back, we talked about, we have this anxiety, and anxiety a lot of times is connected, or we see it connected with depression, right? And so let's dive into depression a little bit. What's one of the main things that you guys know about depression? Like, what's a symptom that you have heard about, or something that people say when they want to describe depression? Okay. Oh, y'all are in the comments tonight. I love it. Yes. Coco said, and that's, let me see, hold on. And that's generational, negative mindset around going to the, yep, yep, definitely. And Nisi, that word crazy, right? So I address that word in therapy all the time, right? I actually tell my patients and the parents too, we don't use the word crazy. One, because it has negative connotations. Two, what does crazy actually mean? Right. So if I'm asking you like, hey, how was your week? And the mom is like, oh, we didn't have a good week. And so I say to the kid, well, what happened? And the kid says, oh, well, I was just being crazy. What does that mean? Right. You could be using that word to describe a number of things. If I'm going to help you figure out what we're going to do about it, I need to know the specifics. So using crazy doesn't help us. Yeah. Okay. So Nisa said sadness. That's the one. Sadness was the one I was looking for. But everybody else is also correct. Suicidal, isolation, hopeless, fatigue, definitely. Hey, Tabril. Yeah. Uh, Dr. Tanika said, don't want to do anything, not interested. All of those. You guys just did all of the symptoms for me. Okay. Now, sadness. I want to go back to sadness for a minute. Can we all be sad? Yes, definitely. Are we all going to be sad at some point? Definitely. Does that mean that we have depression? No. Right? So, some sadness that is normal, that is typical, whatever word you want to use, right? When there is persistent sadness along with these other things that you guys just mentioned, right? So Gigi said isolation, and isolation is being withdrawn, right? So I'm sad. I might have feelings of guilt or worthlessness. I might be hopeless. I might think that people are just trying to put up with me. Nobody really loves me. Nobody really cares about me. They just putting up with me, right? And so what am I going to do? I'm going to withdraw. I'm going to isolate. And is that helpful? Absolutely not, right? Because then all you're left with are your thoughts. And when we're left with thoughts and our thoughts are negative, we're just kind of feeding ourselves the same negative loop and probably digging ourselves deeper and deeper into an emotional hole, right? So we don't want to do that. You actually want to do the opposite, right? You actually want to push yourself to be out with people. We call that behavioral activation. But again, this is for you to really talk about with a mental health provider, because again, there are conditions, right? There are levels to this. Hey, Krista. Krista said loss of appetite, definitely. So that's something, if you remember, we talked about that with anxiety. That is something you also see in depression. And it could go either way. It could be a loss of appetite, or it could be overeating. So both of those things are actually common in with depression, right? The same with sleep. So we saw that in anxiety, we see it in depression. Sometimes when people are feeling depressed, they sleep too much. Sometimes they can't sleep at all. And so these symptoms, the way that these different diagnoses will affect someone will be different based off of that person. Again, that's why you want to go see someone. Okay. Another thing, so Dr. Walker, hubby, says suicide or suicidal, and that is a big one. So a lot of people will be pushed to the point that they start to have thoughts of death and dying. And those aren't always active thoughts like, oh, I want to kill myself right now. Sometimes it's what we call passive suicidality, right? So, I wonder what it would be like if I wasn't here. Or, this probably would all go away if I wasn't living, right? So people think like, oh, that's not that bad. It's still suicidality, and it's still something that needs to be addressed, right? And I never talk to my patients about like, oh, that's so bad, or oh, that's not that bad. Those two things don't really matter, right? What matters is that you're in a place that you don't want to be in, and that's what I'm here for. I'm here to help you, right, out of that place. So we try to make sure that and as providers, we have been trained to not add judgment to whatever is going on in our patient in our patient's family's lives, right? There's no judgment from our side. A lot of times the judgment is coming in from the person who's experiencing it. Like, I can't even tell you guys how many times I've had, patients say, I know I shouldn't feel this way, but da 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 da. And it's like, why are we putting that qualifier there? You feel how you feel, right? You have every right to have your feelings. I had a really cute little boy. He was about 7 or 8 years old a while ago, and he told me God gave us all the feelings. And he was very, very clear that he wanted to have all of his feelings. And I was like, I need you to tell that to some adults, right? Because God definitely gave us all the feelings and we can feel them. We just have to make sure that when they get to be too much for us, that we know what to do, all right? And we know where we can go. Okay. So let me give you a few statistics about depression. Because again, I told you anxiety and depression are two of the most prevalent diagnoses, right? So with depression, it was at about 8.5% of the population in the US, right? Before the pandemic. Now we know the pandemic made everything a little bit worse. Well, that's not fair. The pandemic made these types of situations, so depressive symptoms, anxiety symptoms, it made that worse, right? Actually, I think the pandemic in some ways gave us the room to figure out how to do some things differently and how to slow down and how to appreciate life more. Right. So I do think, and that's another live, we can talk about that. But I do think the pandemic gave us some room to do some things that would be healthier. But there were a lot of people who were hit with more emotional concerns because of the isolation, because of, the deaths, because of people getting sick, because of just that fear and worry about that. And on one of the lives, I will tell you guys about how I pretty much worried myself into the hospital during the pandemic. For people that know me and know the story, I ended up with a gallstone. Never had a gallstone before in my life. We don't have a history of gallstones in my family, right? I haven't had a gallstone since then. But I was really trying to stay on top of myself and make sure my family was safe and also make sure I was doing my job. And sometimes we can worry ourselves into like poor physical health. All right. So one day I'll tell you guys about that. Okay. All right, Eddie, you said let's have that discussion next. Tell me what you mean a little bit more. Drop a little bit more in there about what you mean. Okay, so depression. So it was at 8.5% before the pandemic. It got up to 27.8% during the pandemic. So that was the beginning, so 2020. 27.8%. New research has revealed that not only have the rates of depression persisted into 2021 and I'm sure into 2022, but they actually even climbed to 32.8%. So pretty much 1 in every 3 American adults are experiencing symptoms of depression. All right. That's a lot of folks. And so that brings me to what I wanted to kind of leave with you guys tonight. I want to make sure that we are removing the stigma, and I try my best, and my colleagues and everybody I know that's in the mental health field, we try our best to destigmatize mental health care because it's needed. And so on one of the other lives, I will tell you all how many people we think are actually receiving help or have actually accessed help out of these numbers, right? Because as you can imagine, it's nowhere near the same numbers. All right. So we have a lot of people experiencing things. We don't have a lot of people going for help. And part of that is because of the stigma attached to it. And for some reason, when families come in, and I love working with kids because kids are so amazing. And when they come in with their families, you see all of the kind of inner workings of the family, right? So you have a kid that's coming in with anxiety. Maybe this kid has had anxiety for years and the family just didn't recognize it. The kid also didn't have words to put to it, so they didn't know what to call it. And so let's say now, they're 13, 14, 15, but they, when we get them in therapy, they say, oh, I've been experiencing this since I was 8 or 9 years old, right? People will assume that, that meant that they missed something or that they are a terrible parent because they didn't catch it. And so then we have parents that have a lot of guilt. And does guilt help us? Not at all. Guilt does not serve us, right? Shame definitely does not serve us. And so sometimes people will shy away from help because they feel guilty or they feel shameful. And so a lot of times in therapy, I'm spending the beginning trying to do what we call build rapport, build that relationship. And I'm also trying to, help them see this is not your fault. It's not anybody's fault that we have, anxiety or depression or ADHD. There might be some environmental things that are, maintaining those symptoms, right? So if you're in a high stress situation, that's going to exacerbate your symptoms, right? But it's nobody's fault. And so let's do what we need to do to make sure that we are living a happy, healthy, and whole life. Okay. All right. Okay, so I'm trying to look at the comments here. Um, Hold on. Tabriel said it's amazing how trained adults are to feel ashamed of feelings. Yep. Yep. When we cry, most hide. Tabriel, that is such a good point. And I spend a lot of times having to, or a lot of time having to like kind of retrain even the adults. So I tell people like, I love kids. I work with kids. I also have to work with adults because kids don't live in a vacuum, right? My colleague Brian, who is on here, has this amazing kind of analogy about why we work with families, right? And so, the bottom line is kids aren't here by themselves. They interact, right? They're within families, they're within ecosystems. And so, a lot of times when I am dealing with, child anxiety or child depression, I'm also dealing with adult anxiety and adult depression. And our kids are watching us. And so, if we are not modeling how to be healthy, happy, and whole, we're modeling something and they're seeing it. And so, Tabriel, I have plenty of parents who are uncomfortable with their feelings. And it's like, well, how are we going to tell the kids that they need to be able to tell us anything and they need to work through if we're uncomfortable with it? All right. Okay. All right. Eddie says, so you spoke of the pandemic and the benefits. But for me, yeah, no, Eddie, I definitely understand. And you aren't the only one. There are a lot of people who had that experience, right? And even though I can see some good parts of kind of like the time that it gave me and the space it gave me. Like I told you a minute ago, I still ended up at the hospital with a gallstone, right? So I definitely also felt some of those effects. But Eddie, you're not alone at all. Yeah. Dr. Tanika said, with depression, there are different levels and how you treat. What does that look like? Oh, a high level. Okay, so with depression and with anxiety, right? Like there are sometimes significant symptoms. Sometimes these things get to be so significant that you are not able to function. And having impairment in functioning is one of the things that's needed in order for you to actually get the diagnosis, right? So you can have like some of these symptoms, but if you're still moving and doing and you're productive and you're saying that you don't have any concerns, you don't get the diagnosis, right? But if you're having impairment, so like low level impairment would be, oh, I'm having difficulty doing my schoolwork because I'm having these anxious thoughts, but I'm still going to school, right? I'm still doing the things that I need to do at home. I'm still talking to friends. That's like a low level of impairment. There are some like really intense levels of impairment. So when I worked in the intensive anxiety clinic in at the University of Florida, we had people that would come from all over the country. They would stay in Gainesville, and we would do intensive treatment with them daily. That's because they had really intense symptoms. So, for instance, you might have a patient who has like a germ phobia, and it's so bad that they're taking multiple showers a day, and those showers can last, up to upwards of an hour, hour and a half. You might have a patient that is the same with a germ phobia. They're using a bar of soap a day, and their parents, had to like maybe get all of the plumbing reworked in their house because all of the excessive use of soap messed up the plumbing. So that would be like a really high level. Can this land you in the hospital? Definitely, right? So it's with depression, if we get to the place that we have active suicidality. So we are like, you know what? This isn't worth it. I don't want to be here anymore. And I want to, I have a plan to end my life. The very first place that you're going is to the hospital. And I am very clear with my patients about that because my first goal is to keep you safe. And I will tell them I can't work with you if you're not here, right? And I promise you it's going to get better. We just have to get you past that point where you feel like it's not worth it. And because our feelings change, right? Because these symptoms will kind of ebb and flow, you will get to a place where you feel better. I just got to keep you safe until you get to that place. That's what the hospital is for. And so we'll talk about taking the stigma off of being hospitalized as well, because that's another battle. Hey, Dr. Shalonda. She said, my adult patients are often surprised. Yeah, yeah. So, there are plenty of parents when I give them the symptoms and when I give them psychoeducation about what depression is and what it can look like and how it can show up in your life, they'll say, that's what I felt as a kid. I didn't know. And a lot of times we don't know, right? And because people are resilient, right? Like we take hits and we bounce back, right? People don't always stop to figure out what's going on. The issue is the more hits we're taking, if we are not in some way addressing that, we don't bounce back the same way, right? And for me, more importantly, we're not living the life that we could live. So I tell my kids all the time, because kids pick up on this from adults. So they'll say, oh, it's not that bad. I'm okay. I know I got anxiety, but I can deal with it. I'm just gonna keep the anxiety, right? I don't want to do the work it takes to get rid of the anxiety. Right. And so what happens with that is I'll tell them, are you swimming or are you treading water? Right. Because those are different. Treading water, we just kind of keeping our head up. Right. We're doing a whole lot of movement under the water. We're keeping our head up, but we're not going anywhere. We're not using our full potential. And so a lot of times that's what happens when we have these different symptoms and we don't go and get them checked out or we don't address them. We're just treading water. We're still here, right? We're still alive. We might be living, but are we thriving? All right. And I want my folks to thrive. To be honest, I want everybody to thrive. So that's really why I do what I do. Okay. So, guys, that's it for tonight. Hold on, let me see. I will, because I do want to answer all the questions. Wait, do we see levels of anxiety increasing as we return? Yes, definitely, Dr. Tanika. Yeah, we have seen that in the schools. We've seen that with adults, right? Because we're going back in. We haven't been back in these environments in a while. So a lot of teachers are telling me, hey, my kids seem to regress. They don't even have the social skills they had, when we left in 2020. That's because they haven't had to use them. I've known of patients that they started back having to go to school. They were getting car sick. They never had car sickness before, but it had been so long since they had been in a car, and they were so nervous about it that they were actually vomiting in the car. All right, so we definitely see, or saw a rise in anxiety as we went back into the workplace and into the world. So that brings me to, I will tell you guys one last point. That brings me to the point about wait list and mental health providers being stretched thin, which I mentioned at the beginning. There are so many people that need help. And so one thing that I want to make sure I left with you guys tonight is, if you think that you are experiencing any of these things, right, that we've discussed, if you think that you know someone that's experiencing any of this, let's get to a mental health provider sooner rather than later. You might go in, they might do an evaluation, and they might say, you know what? This is just kind of adjustment concerns, right? Adjustment is kind of the lowest kind of diagnosis we can give, right? Like the least severe diagnosis we can give. So it's just like, oh, we're having a few issues adjusting to going back into the workplace, right? So like, let's do a couple of sessions, or maybe you don't even need any sessions. Let me give you some, recommendations and send you on your way. That happens, right? We don't keep everybody that we see, right? But if you think you're having any of this, definitely reach out. You can start with your primary care physician. And I'm going to go through this in a lot more detail, probably in about week 4, when I talk about finding mental health providers. All right. But you can start with your primary care physician. You can tell them, hey, I'm feeling something. I'm noticing something in my kid, or if it's your niece, nephew, cousin, whatever, talk to their parents, right? Or talk to them if they're an adult, and try to encourage them to at least go get it checked out. Right. It might be that, nope, this doesn't meet the threshold of a diagnosis, right? Or actual mental health disorder, or there might be something there. And because we know everyone was impacted by the pandemic and just life, right? Not just COVID, we still have a racial pandemic in our country, right? Like there's a lot of stuff that affects us, day to day. And so it's nothing wrong with going to get help when we need it. Okay. All right. Yes, Dr. Walker, help is healthy. Yes, definitely. All right. All right, guys, thank you for joining me tonight. Join me next week. We're going to talk about another mental health diagnosis and what you can do and what, strategies you might be able to use. And I will see you then. All right, same time, same place. Bye, guys.